Hello, everybody. Thank you so much for joining us for our Healthy Communities webinar series, Policy Pillar. My name is Madison Drader. I'm a program officer of events and education with Communities ChooseWell. Before we begin with the presentation, I'd like to begin with a land acknowledgement. So I'd like to acknowledge the First Nations, the Métis, and all of the people across Alberta who share a history and a deep connection with this land. We dedicate ourselves to moving forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. I myself am calling today from Treaty 7 territory here in Calgary, so I would just like to acknowledge that. As I've already done, I invite everyone to acknowledge and let us know where they're calling in from. A few housekeeping things for today. You might be wondering why I've called this a webinar when we are in fact in a Zoom meeting room. And this is it's still a webinar, but this is just to encourage more conversation and interaction between you, the audience, so the folks that are here to learn today, and then also our presenters. So yeah, we just hope that this format kind of encourages more face-to-face chatting throughout the webinar. So feel free to put any questions you have in the chat box, and I'll try to bring those up as we finish the webinar. Also, we are recording the webinar, so we can make it available for others to view afterwards. So that will come out after the webinar. Okay, just to give you a little idea of what this webinar is all about. This series is designed to focus on each of the key areas of our Healthy Communities framework. These areas are also known as our pillars, where communities can take action to build a healthier future. Definitely take a look at our Communities ChooseWell website to learn a little bit more about our framework and more specifically our policy framework. I won't go into detail about the specific policy pillar on our framework, as I know that Candace and Laura are gonna do a pretty good dive into that piece. And within our policy pillar, we also feature their policy readiness tool a ton on there. So I'll leave that for the experts today. Before we get into it, I would just love to introduce our guests for today. So today we have Candace Nykiforuk. Candace works as a professor and a scientific director at the Center for Healthy Communities in the School of Public Health at the U of A. Candace has expertise in community environments, health equity, and systems approaches to improve population well-being. She currently leads several interdisciplinary cross-sectoral collaborations on healthy public policy research. She also has an extensive track record of mobilizing scientific evidence in tools and strategies, which has directly informed practice and policy in municipal and provincial governments, workplaces and communities, and national NGO strategic directions. Candace was honored to be inducted as a member of the Royal Society of Canada's College of New Scholars, Artists, and Scientists, among other honors for outstanding innovative research and engaged scholarship. So super excited to have Candace and welcome her here today. Joining Candace, we have Laura. Man, I even asked Laura how to say her last name before we came here, and I already am unsure. Laura Nieuwendyk. I think I got it good. Laura, you can correct me after if I was wrong, but Laura, we're super happy to have here today as well. She is the senior program lead of the Center for Healthy Communities and the Policy, Location, and Access in Community Environment, also known as PLACE, Research Lab, which is also led by Dr. Candace Nykiforuk. Specifically, her role in the Center and Place Research Lab includes providing leadership and direction for the development and operations Laura also oversees the day-to-day activities and upholds key local, provincial, and national partnerships as necessary. She contributes to research and evaluation activities and associated knowledge exchange, strategic planning and grant development, financial planning and management, communication, and community engagement. So again, super excited to have Laura and Candace there. As you heard from their bios, they have a ton of knowledge and expertise in that policy area. And then also we want to welcome Julia Soucie with us today. She is an avid Communities ChooseWell champion and this past year's 2022 Communities ChooseWell Champion Award winner. Her passion for recreation, children, and youth brought her to Fort McKay in 2009, where she works as the director of Fort McKay Wellness Center, a nonprofit organization providing quality recreation and leisure programs for Indigenous children and youth. Julia has done a ton of amazing policy work within the healthy eating and active living realm. And today she'll be telling us about the healthy policy she's created to increase employee retention. So with that, I'll stop speaking and hand it over to our experts. They'll share their screen and they're going to present on the policy readiness tool.
Thank you so much, Madison, on behalf of Laura and myself for such a kind introduction. And I just have to say, we are super excited to be here today. The ChooseWell communities are just beacons of positivity and health promotion and change in our province. And it's just really fantastic to be having a conversation with all of you today. So I'm just going to dive right on in because I know we have a lot to do in a short time to do it in. Laura and I are here today to present on the policy readiness tool. This is something that some of you may be familiar with, and I'm hoping might be new to a few of you so that we can have all kinds of conversation. And we're hoping that when you leave the webinar today, you feel a little more ready to initiate policy change within your own settings and with different stakeholders that you work with. The work we're talking about today was developed by my team in the Policy, Location, and Access in Community Environments, or PLACE Research Lab, a number of years ago, but it continues to be implemented in new settings every year. And we're always excited to have the opportunity to share the work and to talk about it with different folks. So the Policy Readiness Tool, or the PRT, as I'll call it for short, was developed in order to help support the policy change process, specifically in communities and municipalities and organizations, or really any kind of setting you're hoping for policy change within. It was designed at a time when there was a lot of push towards changing policy, but very little sort of hands-on guidance into where do you even start. And it can be really intimidating for people who that's not their everyday job. So for the presentation today, we're going to start with a high-level introduction to the tool, so you know what it is before we dive into discussing why a policy approach is important. And then we're also going to talk a little bit about how the tool was developed so that you get a sense of what's behind the machine, so to speak. And then we're going to talk about how level of innovation influences the policy change process. And finally, we're going to share how you can apply the PRT in your own setting. So before we get into the tool itself, I just want to get a quick sense of where you're all at with the policy process. So using the poll that just popped up on your screen, could you please respond to the question that you see there, or what your capacity is to support or influence the policy process in your community or setting? I'm just watching the numbers go up. We have about halfway there, so I'll just give another few seconds for people to get their votes in. Just the last call for votes. Okay, I'm watching it not move. So I'm going to go with what we have right now. And I'm seeing a real range across the room. So we have about 14% of the room feels that they have high capacity. About 46% feels they have medium. About 24% feel that it's low. And another 16% feel they're not unsure. And interestingly, our results today are pretty much what we see in every room that Laura and I have this conversation in. And it's also really reflective of policy capacity for policy change sort of on a broader scale. So it's so wherever you are is an okay place to start. And it's really good to know that we have a whole different range of experience in the room today. So why don't we just keep going on with the presentation? So overall, excuse me, the goal of the policy readiness tool is really simple. It's to make engaging in a policy change process less intimidating by offering a place to start and offering some strategies and tools to guide you on the process. This tool is designed to be used by absolutely anyone who is interested in encouraging healthy public policy development. So that could be from a citizen to a policy professional. And as you'll see later today, the tool is very simple to use, and it's also available in English and French. The great thing about the tool is that it offers a place to start. And I know for myself, when I first started working in public policy, I just felt like that was a job for people more experienced, smarter, different job than me. And what I learned over time is that policy is actually for everyone. And it's about creating conditions for everyone to be able to choose health and to have and enjoy a quality of life. But what we know for sure is that the policy process is really dynamic and it can be convoluted. It is certainly not a linear process. And this is where the PRT comes in. It's designed to help individuals or communities or organizations assess their communities or organizations' relative readiness for policy change. So how ready is the group for change really? And then points at a direction to start with that level of readiness in mind. And it's all evidence-based, so you know that the strategies that are in it are designed for that level of readiness. So the targeted strategies in the tool are particularly helpful for those who are new to advocacy or new to policy development. And then within your own teams, some examples of settings where the tool could be applied include the municipal level, organizations in a municipality, recreation centers, not-for-profit organizations, and lots of others. And these are just some examples of groups that we've worked with in the past or of who have taken up the tool in the past. And I'm sure you could think of many more where this might fit. So why is healthy public policy important? Well, healthy public policy is essentially any policy, not just health policy, but any policy in any sector that improves the overall health of a population or community and seeks to increase an individual's or community control over the root causes of ill health or positive health. So in that way, healthy public policy is a key health promotion strategy. And the evidence over the past 30 years has clearly shown us that when we want to promote health at a population level, a policy approach is often the most efficient way to go. So we know to build healthier communities, then, it's really important for local organizations, advocates, and others like you to be involved in the policy process change. It's not just for policy professionals. And so to do this, we need to increase our capacity to support that change. And that's the policy readiness tool, and taking part in webinars like today is one way to do this. We know from the long bodies of research that municipalities and organizations learn policy responses from similar communities or organizations. So the PRT provides a tool to help users navigate that process in their own setting and tailor it to their own unique priorities. And this is what ultimately led to the development of the tool itself. So I'm not going to go into all the little details around the theory or the actual process that we use to create the tool. We can absolutely talk about that during the conversation. But one thing I do want to highlight is that the tool is based on Rogers' diffusion of innovations, which looks at how something new, like a policy idea or practice or initiative, spreads from place to place or group to group over time. So the tool uses level of innovation, which looks at whether a community or organization is relatively earlier or later in taking up a new ideas than others in the same system. And Laura, next slide, please. We may want to skip ahead to the next one. Perfect, thank you. And to develop the tool, we built on previous smoke-free spaces work that showed how initial adopters of a policy are often also the first to amend or strengthen their bylaws later on in time when evidence changes. So what we know from smoke-free spaces bylaw work was that municipalities followed the same pattern of policymaking within their network, and that different characteristics of those municipalities showed different levels of readiness for policy change. And so at this point, I'm going to pass it over to Laura to talk more about the policy readiness tool itself and really get into the more interesting part of the presentation. So over to you, Laura.
I don't know what more interesting, but I'll take it from here. So what is the policy readiness tool? The tool itself includes 3 different parts. Part 1 is a simple self-administered checklist that will help you assess readiness for policy change within the community or organization you are working with. So the checklist itself has 11 questions and is similar to like a magazine quiz where you select the most appropriate answer, whether that's A, B, or C, and your total score for each of these categories will help you identify relative readiness for policy change for a particular question or scenario or whatever topic you are looking at. So the checklist will help you identify which of the 3 readiness categories your community or organization best falls within for the topic, including innovator, majority, or late adopter. What is really important to emphasize at this point is that the tool assesses relative readiness for new policy, and this may be different for different issues, policies, or ideas. So it is important to revisit the checklist for every new topic, as the response will not be static. The other really important caveats to keep in mind are that the level of readiness is not a value judgment. There's no good or bad adopter categories. Rather, the tool provides a way to help you identify the strategies that will work best for within your context to move a policy issue forward in that particular setting. So it's not a one-size-fits-all solution, but rather a place to get started. So typically within the checklist, once it's completed for a range of topics across an organizations, you'll see where organizations typically fall. And I think what's so interesting, and I smiled at the beginning when everybody did the poll, is we literally had this exact bell curve happening within the room. And we see this repeated over and over again in all the presentations that Candace and I have had the privilege of doing on the policy readiness tool. So where there are fewer number of organizations within the innovator category, the majority fall within the majority category, and then a small number within sort of that late adopter category. So I'm now going to spend just a couple of minutes providing a quick introduction to these levels of readiness. So if your organization aligns with mostly A's category, they are considered an innovator. So this group is described as adventurous. They can typically tolerate higher levels of risk and cope with elevated levels of uncertainty. They often serve as role models for others within their network. For example, other organizations who may look to them to see what they have done and how they have responded. The B group is a majority group, and they are described as deliberate, as they often require time to consider the evidence to determine whether to adopt something new. They think it's better to change as a group rather than to be the first to change. If your group falls within the mostly C's, they're typically more of that late adopter group, which is described as traditional. So they may be skeptical of new ideas and require a substantial amount of evidence before making a change. They're often eager to maintain the status quo, and they sometimes need to be pressured into policy adoption and may never adopt unless required to. So for example, not until provincial legislation actually comes in. So the full tool where you can assess your community or organization's level of readiness for policy change is available online at policyreadinesstool.com, and we'll have the link available at the end of our presentation. When you go to the website, you can access all three components that we'll be going over today, as well as a lot of other information about applying the tool, who should use the tool, background on the tool, etc. So the second part of the tool is the strategies themselves. So once you've identified your community or organization's level of readiness, the tool provides evidence-based strategies to help you take action. So the strategies are tailored to the level of readiness of your community or organization. And while the online tool provides much more detailed information, to give you a quick snapshot, here are some of the highlights from each of the different adopter categories. So as you'll see on the right-hand side, there's a screenshot from the website where you can actually find the specific details on the strategies. And as you can see, they can be expanded out and there's a lot more details there. But very briefly, the strategies for the innovator sort of category are provide supportive evidence, frame the issue to appeal to the innovative spirit, build relationships with champions, generate decision maker support, and raise public awareness by educating community members. So when we go to the majority category, again, there's much more detail online, but very briefly, strategies to be used with the majority readiness level are provide evidence and outline public opinion, frame the issue from the majority perspective, engage and mobilize the community to take action on the issue, build relationships and maintain momentum, and provide tools and incentives for policy adoption. So finally, for the late adopter category, some of the examples include educate decision makers about the issue, provide evidence to illustrate that the benefits outweigh the costs, build strategic relationships with key community members, understand the unique needs of the community and address underlying barriers, and mobilize the community to take action and move the issue forward. So something that's really important that I want to point out that we always get questions about when we do these presentations is that you'll notice across the innovator, majority, and late adopter strategies, one of the strategies is to provide evidence. So as you look at the strategies in more detail online, you will see that there's intricacies between each of these. So for example, for the innovator group, the evidence that's required will be less concrete. Whereas the majority group, it's good to show evidence of how other groups or organizations have implemented and what their experiences have been. Whereas the late adopter group will require concrete evidence of how others have done this and the outcomes, public support for the issue, and the positive impacts of other organizations doing the same work. So finally, the third part of the tool is the supporting resources for each of the strategies provided. So we're not going to go into all the resources today, as they are directly related to each of the strategies and level of innovation, but I would encourage you to visit the website to access these resources and explore how they can apply to your work. So before we go into some concrete examples of the tool's applications, it's important to point out who should use the policy readiness tool, as this is often a question that we get from participants. So as Candace emphasized at the beginning, it is not meant to be used by seasoned policy advocates. In reality, it's meant to be used by anyone who is interested in healthy public policy development, whether that is the seasoned policy advocate, community organizations, or the general public. So just as the tool can be used for a wide range of people or groups, it can also be used for a variety of different topics and is not limited to policies, but rather can be used with any practice, policy, product, idea, or initiative, as long as it's considered new by the unit adopting it. So the other important thing to keep in mind is that the tool was originally developed with municipalities in mind, but can be used with any governing body, whether that's an organization, workplace, school, etc. So recognizing the value of the tool in other settings and some of the barriers around the usage of the policy language, we partnered with Alberta School Employee Benefit Plan a couple of years ago to develop the Idea Readiness Tool, which was built from the evidence-based policy readiness tool, but was designed specifically for use in school settings. And I'm going to pass it back to Candace now to speak a little bit more about how these tools have been used in practice.
Thanks, Laura. So the first example I'm going to share is actually from the Idea Readiness tool, which Laura just mentioned, but the lessons apply across both tools. In this example, an administrator from a school authority in Alberta had attended a session to learn about the Idea Readiness tool and saw a value in using the tool within their school authority. So she got her wellness team together to apply the tool, and it provided a place to start where she got her administrators, teachers, and wellness champions, and some others working to support school wellness to come together. The tool provided some common reference points around change, awareness of readiness, and how to assess readiness. And then they created working examples within their team to get some hands-on experience with the tool, as well as a framework for how to apply it in both their school and their division. And from all of that, they identified some benefits as the tool providing a place to develop a common language for their group around change within the school community. It helped them get a common understanding of benefits of each stage of readiness and different strategies to get started depending on that stage, or if different groups were at different stages. And then some feedback from participants was that they had appreciated the time to share, collaborate with their colleagues around a shared topic, and they really felt it was helpful to gain understanding of different perspectives and motivations for change. And they were also able to work together to generate ideas on how to inform buy-in for the change that they were working on. So in this example, and one way after this workshop that you might want to think about applying the tool yourself, is to work as a team with your colleagues to apply the tool together and develop an action plan around a specific policy topic that you may have in common. So another example is from our partners with the Alberta Policy Coalition for Chronic Disease Prevention. They used the policy readiness tool to develop policy resources for municipalities who were at different stages of readiness to create healthy food environments in recreation facilities. So the coalition worked with the municipalities to complete the tool, identify levels of readiness, and then apply the policy resources that they developed based on the level of readiness that they had figured out for the municipality. So in this example, capacity was built by sharing resources that could be used across different settings. And then in a broader application like this, where a team comes together to help tailor the strategies and resources to a specific policy topic, like healthy food environments, for all different levels of readiness, then these strategies could be shared and individually be applied at the organizational or jurisdictional level based on their relative level of readiness. And I know I said relative and readiness many times in that sentence, but it's all about being flexible and about having a way to quickly triage where a particular group might be at with a particular issue. So just to wrap up, what we've learned from practice to date is that it's really important for adopter groups to interact in order to share their successes and their challenges. And it's also important to make sure that the activity of innovators and risk takers is out there and visible so that people can learn from their experiences. We know that the policy change process is dynamic and that it's very convoluted, and this is important. What seems like it might not be moving forward now can actually move very quickly with a change in leadership or some other external factor. So for example, I'm sure you've all experienced through the pandemic that there were brand new opportunities to bring in different changes or policies that might not have been entertained previously, or potentially the very opposite of this effect. So it's important to remember that you need to be open to policy windows and prepared for them, and ready to act when they open to you. So some of the strengths of the tool are that it builds personal and community level capacity. It provides strategies and resources for all different levels of involvement in the policy process. And as Laura said, whether you're a skilled advocate or very new to the policy change process, there's something there for you. And it builds knowledge through intersectoral collaboration. Some of the limits of the tool is that it is time specific. So it's important that you revisit each new issue and with any changes in the organization, like a change in leadership or a change in funding, for example. It's most applicable to single issue topics. And finally, it's really important that you stay flexible and leave room to act on the unexpected. You're not the only group using the PRT. And as you'll see, if you could go ahead to the next slide, please, Laura. As you can see in the slide, it's been profiled in multiple locations across Canada, and we've had downloads of the tool internationally since we first moved it online about 10 years ago. And it's really hard to believe it's been that long already. So as we close, I just wanted to specifically acknowledge the Alberta Policy Coalition for Chronic Disease Prevention for their support and feedback in the development of the tool originally, as well as thank the multiple funders of our research over the years. And they're all listed on the screen there. And just on a final word, to thank you all again for joining us today. On the screen, you'll find contact information for myself and for Laura, as well as the links to the PRT website and our PRT email. And just please feel free to reach out anytime. And that's it for us today. Thanks.
Awesome. Thank you so much, Candace and Laura. I really love how the tool is like not a one size fits all, and it's very much a, start where you can and with what capacity you have. And I think that's really great, because it really opens the door that it's like, if you don't have this huge amount of capacity to do this huge change, you can still, start where you are. Okay, now that we've been given a really amazing evidence-based tool for, starting a policy, I want to hand it off to Julia to give us some on-the-ground examples and steps that she's taken within our organization to create some really amazing healthy policy. So Julia, I'll hand it off to you to let me know if
Awesome. Thank you, Madison.
You're welcome.
Change my screen here. Okay. There we go. Minimize this here. So hi, everybody. My name is Julia Soucie, and I'm with the Fort McKay Wellness Center. As Madison mentioned, we're a nonprofit organization located in the community of Fort McKay First Nation, and we provide after school leisure recreation programs, summer camps for all the children and youth in the community. So this past year, we created a new policy on employee and volunteer retention in the recreation sector. So I'm going to talk a little bit about how we developed that policy and then show you a little bit of the policy later on as well. So just as I mentioned before, we do programs for children and youth ages 5 to 17. And these slides will be available later. I'm thinking maybe Madison will be able to share them. But so basically, why was employee and volunteer retention important to us? Why did we decide to do this policy? So we kind of felt like it should be a top priority for all organizations and businesses, especially in places that work with children and youth. So being in a rural First Nation community, we work with a lot of children and youth, and it takes time for those children and youth to form bonds with staff members. So whenever we have new people coming in, there's always that hesitancy. It takes time for them to really trust those new employees. So the longer we have people around, the better. And we don't like to have a high turnover rate because it could be traumatic or damaging to the children and youth we work with. So we wanted to make sure that we can keep our staff for the long term so that our programs will be better and the children and youth have that consistency there. So in our minds, when an employer invests in their employees, the end result is going to be better performance, higher work quality, and positive work environment. Again, if we have those high turnover rates, we're going to have higher costs. We're going to have staff shortages. When we're short on staff, that means the rest of the staff have to work twice as hard, which could cause them to burn out and eventually leave as well. So we don't want that to happen. So our next few slides are going to show how we created that policy, followed by the 7 key retention strategies that we're using to help our employees feel valued and appreciated, resulting in long-term employment. So just a little bit of a background, we have an extremely low turnover rate. Since I've been there since I've taken over executive director in 2012, we haven't had anybody leave because they're unhappy. We've had a few people leave due to relocating with their spouses, or employees going on maternity leave and becoming stay-at-home moms. So yeah, so it's been working so far. So the policy was created. So all these things that we do in this policy were always kind of an unwritten rule that were passed on from the previous director. So I remember starting there in 2009, and I was just wowed by like how great we were treated by the executive director. I was like, wow, like, you know, you remembered my birthday and that kind of things. And it really made me feel special. So I apologize, I have a sick daughter home today. So yeah, so I just so then I kind of carried that along when I took over, and then it kind of got to the point over the last year where it was kind of like, you know, what happens if I ever leave, or what happens if something happened? There's nothing written down about this. Like, how can we make sure that these things are carried on for the future and for all the staff and everything? So we didn't want to have that lost along the way. So we're like, let's make this a policy, let's get it on paper, and then that way we can ensure that it's going to stick around for a long time. So the hopes of sharing this policy is so that other organizations and businesses follow through, creating happier, healthier people in the workplace. So again, just starting out with creating the policy. So as I mentioned, like most of the items in the policy were things that we were already being done unofficially by the executive director and board of director for the past 11 years. So they were never formally written down. So we wanted to create that formal policy, which then we had to do some background work. So we did a lot of research online on what strategies were recommended by professionals and consulting firms who had done studies on employee and volunteer retention. The staff were consulted on what was important to them. So we're very close knit with our close-knit workplace. We include our staff and our volunteers in any kind of policies we make, any changes we make to the workplace. They're the ones that are working on the front line. So we want them to have input on what makes them happy. And then we also did discussion with random people, like when we were out in the community, friends and family, like what makes you happy at your workplace? Like asking people, you know, if they've ever worked at a great workplace, what was something that was done that made them feel valued, in hopes that maybe we could adopt that into our policies as well. So all of those unwritten strategies that we were already doing, we put those to paper, created a budget for implementing each strategy, and then a draft of the policy was put together by myself, and then I presented it to the board of directors, and then eventually in the end, the board of directors unanimously approved the policy. That was just kind of a quick overview. So the step one was the research. So again, we did research on why people left their jobs, what experts recommended as far as employee retention based on recent published studies, talked to other organizations, as I mentioned, again, consulted the employees and volunteers, and then talking to other organizations and stuff too. Like I know, you know, at one point I even had talked to ARPA, and when I was talking to them about this policy, and how I was going to present it at the recent Energize conference, some was shared. They're like, oh, we do this at our workplace too. So it was great to see that these were done in some other places as well. And again, helped us with developing that final policy. So then creating the draft. So once the research discussion was completed, then we need to put those ideas onto paper. So again, doing everything informally, we wanted the official policy to ensure the way that employees and volunteers are treated did not get lost along the way. You know, you don't want a new executive director to come in and change everything up, and you know, now all the staff are leaving when we've worked so hard to keep them there for so long. So through the above methods, we created that policy, which included 7 pillars to retain employees by being a great place to work. Again, did the draft of the policy, and each pillar actually includes a variety of tips to consider for each strategy, which was then presented to the board of directors in April 2022. Then we made it official. So after necessary edits, final draft of the policy being approved as of September 2022, it's an official policy. It's now added to our board manual as well as our operations manual. And then the budget for this policy, it is reviewed each year and may vary based on yearly circumstances, funding, and particular strategies which might come into play in that year, such as if there's a need to increase health and wellness benefits. So we look at that yearly and see where we need to adjust that budget. Yeah, so that's kind of how we got everything started. So I'm just going to do a little brief overview of this strategies policy, show you a little bit of the 7 pillars. I won't dive into each one. Each slide will have some tips to consider. You're welcome to read those on your own, or Madison can always provide a copy of the slideshow afterwards if she's able to do that. But
Yep, I can definitely do that, Julia. Perfect.
awesome.
Thank you.
Thanks. So these are the 7 retention strategies we use. So we use these for both employees and volunteers. So we want to recognize and reward. We offer professional development opportunities. We celebrate accomplishments. We support our employee wellness. We provide regular performance reviews and feedback, including employees in decision-making when possible, and working alongside employees when possible. So I'll just do a little brief overview of each one. So recognizing and reward. So as humans, we want to feel as though we're appreciated and that our hard work does not go unnoticed. So employees that feel valued are more likely to stay long-term. They're also more likely to go that extra mile and contribute more to the organization or business. So there's a whole bunch of different ways you can do this. It's not limited to this. It can be done on any budget. So we'll share those with you after. Next, so professional development opportunities. So they're important to help employees grow, challenge themselves, keep up with the current trends in the industry, as well as renew an employee's passion for their work. If they're able to learn and grow personally and professionally, they're going to contribute more to the team and share their knowledge and passion in their work. Celebrating accomplishments. So this is similar to recognizing and rewarding, but it's also important to show the employees that we care about each and every one of them on a personal level. When you have that personal work environment where everyone feels like family, it's a rewarding place to work, resulting in happier, healthier employees. So this could be something like celebrating work anniversaries, even something like celebrating milestones in an employee's life, such as their birthday, graduations, weddings, having a baby. Can be done in various ways, but it shows that you value the employee as a person and not just another number clocking in at the end of the day. Supporting employee wellness. This is a very big one right now, especially given the pandemic and all the implications that came out of that. So this is a great, if you're going to start anywhere, start with this one. But a happy, healthy employee is essential to a positive workplace. So if you invest in your employee wellness, it's going to contribute to your work culture, your work atmosphere, and the employee's performance. An employee who's happy and actually enjoys being at work is going to go above and beyond for their employer. So there's a whole list of different things that you can do to support that. Regular performance reviews and feedback. So providing them with a regular performance review and feedback will give them the opportunity to grow, to recognize their own strengths and strengthen their weaknesses. If they're unaware of their performance and are not encouraged to grow, they may become unmotivated. The way that we do ours, we have the employees complete a self-evaluation prior so that they can review their own work, share their individual accomplishments, and set their own goals. Once we receive that back, I go and I do one as well. But the great thing of how this one works is that sometimes employees don't see all the amazing things that they've done. So when they do that self-evaluation, and then when I go back with them and do these reviews afterwards, I'm like, oh, you forgot that you accomplished this and you did this and you did this. And it kind of leaves them feeling great at the end of the day, because a lot of people don't know their worth and they might not see all the amazing things that they do. So it's great as an employer to be able to provide that extra insight and, show them that they really have done amazing things. So the next one, including employees in decision-making when possible. So again, even when we were creating this policy, we talked to the staff, we talked to the volunteers, and we asked them, like, what makes you feel valued? Like, is there something that's missing here? You know, is there something in other workplaces done that's made you happy and want to stay? Because we don't want to lose them. And sometimes as managers or higher ups or board, you might not have that day-to-day with your employees to see what they're doing or what they might need. So again, sorry, the staff are on the front line, so they know what the day-to-day is like, whereas management might not always see that. So they can definitely provide valuable insight. And again, an important note about this one is that never discredit an employee's feelings, suggestions, or input. If they're offering a suggestion or asking for something, try your best to look into it and take it into consideration. We all know not everything's always possible, but it's easier to say, you know what, it's not possible right now, let's revisit this in 6 months, than, you know, shutting them down and telling them like, well, that's never going to happen, because again, that's going to make them feel not valued. And then the last one, and this one came from the staff, and this one came from me as being a frontline worker before as well. And we heard this a lot at the conference from when we presented this, talking to individuals that were attending, was there's always a lot of disconnect between management and frontline workers. Sometimes management likes to pile on work to the employees without realizing how swamped they actually are, or, you know, short-staffed, and somebody's got to do 2 jobs instead of 1. So in our workplace, all of our managers, myself as the executive director, we work on the floor. So we have to spend a certain amount of time on the floor so we know what it's like. And then that way we're not expecting or demanding anything of our employees that's just not possible. And then, you know, that it also works out great in the end too, because then if you're short staffed, then management or supervisors can come and work on the floor and have no problem running the day-to-day operations in the event of a staff shortage. So yeah, so this is a very important one. It also creates an atmosphere where employees are much more likely to respect a manager's decisions if they know that the manager's been there for them on the floor. So this was a very important aspect of this policy that we wanted to include, so that to make sure that it keeps happening. So these are some of the benefits of the policy that we had discussed and that we've been seeing over the years. We're reducing our training costs. We're not continuously training new employees. It reduces interruptions to programs and services as our staffing levels are adequate. Employees are not overworked due to staffing shortages caused by people quitting their job, leaving others to pick up the slack. The employees actually want to come to work. We had a couple of weeks off at Christmas, and everybody was, you know, about halfway through our Christmas break, everyone's like, oh, I'm so ready to go back to work, and I miss the workplace, and I miss my coworkers, and I miss the kids. So yeah, that's definitely great when you have employees that want to come to work every day. Again, the long-term employees are building the better relationships with participants, clients, customers, which keep them coming back. And then employees spread the word about what a great employer you are. So I always joke, right now we kind of have a waiting list of people that want to come and work for us. I get calls all the time. Are you hiring? Are you hiring? We want to come work there. So it's a good feeling that people are spreading the word, and that, yeah, we don't have people leave very often. So we kind of have a waiting list to work here. So just in summary, our employee retention strategies, they help your, oh, I can't see what that word is. They help your team see that we value them as employees and their contributions to the success of the team, helps them build a sense of security in their value and motivates them to continue great work. This policy can boost employee motivation and increase productivity and loyalty, which is beneficial in any sector. In the recreation sector, if employees are happy at their job, it's going to reflect in the way their programs are run and how they're going to engage those clients, program participants, and community as a whole. So again, just keep in mind, these strategies can be implemented on any budget. Get creative and show your employees you care. Hope that wasn't too much of a mouthful.
Awesome. Thank you, Julia. Again, I think this just speaks to the amazing work you've done within your organization. So that's really cool. Also, I'm wondering, based on like your steps, did you secretly use the policy readiness tool to get where you are?
No, I didn't. But again, like I said, it was always kind of like an unwritten rule, like something that we just kind of always followed. It just wasn't on paperwork. But when I had mentioned to the board, you know, hey, we need to make this an official policy, they were kind of like, go for it. Like, so I had already put in a lot of things on paper, and yeah, it was kind of, and it was just me worrying something had happened in my life where it was like, you know, what if I leave? Like, who's going to take care of my people? And so I was like, can I do this? And they were like, yeah, do, you know, do the research, do all this, and go
I
for
love
it.
how you had the you know, the evidence-based part too, because I believe that is part of the policy readiness tool, right? Am I
Yeah.
correct, Laura and Candace? So I do have a question for Laura and Candace. So based on kind of what Julia's told us about where she's at with the policy within her organization, I recall, Laura and Candace, you mentioning something about, you know, once that policy is set up, there is collaboration and conversation that continues happening to revisit the policy, right? Where would you say, like, where would Julia be at to have those conversations, or like from your point of view, if someone had already had that policy implemented, what would that look like?
Well, I hope I'm answering your question right, Madison, but I invite Laura and Julia to just jump in and take over for me at any point. But I would say that, like, it seems to me that Julia and this policy in particular is really an innovative policy. Like, I think, you know, it's showing leadership around psychological safety, around respecting people and retaining people. And just like, I feel like in terms of revisiting a policy, maybe I would reframe that to say, I feel like Julia is probably going to be swamped with lots of phone calls and emails about how can we do this in our community? How can we do this in our organization? Because you took a risk for something that seems like so smart, but that not everyone is doing. It might be hard to do, and you did it. And look at all of the amazing benefits that have come out of it. So I would say that, you know, I think as the policy stays in place, you know, you'll probably become even more of an expert about how a policy like that changes over time, and that you'll constantly, for the entire your length of your career, be fielding calls about, you know, what you've learned along the way, and would you be willing to share that with others. But that's my take as someone, you know, just hearing about the wonderful work for the first time. But yeah, I don't know. I'll pass it over to Julia and Laura in case they want to say anything.
Well, I'm just kind of, I am chuckling because the dialogue was going to be kind of a like, where's Juliet? How can we improve it? And Julia's just already, she's already there. So you've done some amazing work, Julia. So with that, I think maybe I'll move on to another question then that involves all you three to kind of give your expertise in the policy area. So Julia, you had mentioned that a major and important step was connecting like the gap between the frontline and the management team. So when, you know, you're looking at who should be at the table, or how do you get everyone at the table when you're looking to create a healthy policy? So how do we make sure, you know, the different, everybody that needs to be there is there, and we have all diverse voices and everybody that's involved?
I guess I can talk on that. So just with us, like, and as I mentioned, like, this is, our policy was a policy for the employees. So of course we wanted to have their input in it, but you know, again, like, we have 8 employees, so, you know, everything might not work for everybody. So because we wanted this to be an official policy, as I mentioned, like, we consulted the employees, we talked to the board of directors, we talked to random people, we brought it up anytime we were talking, you know, with, like I mentioned, with other organizations, like when I was having conversations with somebody from ARPA about something non-related. It's like, hey, I want to try to do this, and seeing their thoughts on it. So, and then doing that research and getting information from the experts who had done the studies and seeing how their findings aligned with ours. And we picked up a lot of extra things from those studies and from the research that was done, and then just tweak them a little bit to make them fit with our organization. But yeah, I think just the more people you can get involved, the better. You might be missing something, you might not think of anything. And even going back to your last question, like changing policy, like, down the road, while we have this set in stone, we might meet somebody one day that says, hey, well, my workplace does this. And it's like, well, yeah, we should do that too. So you can always adapt it and change or add things on. So I think it always gets better as we go along. But the more people you have involved, the better, because then you have those different opinions, those different views, that diversity and all of that. So it makes it a stronger, better policy.
Candace and Laura, do you have any thoughts on who else should be at the table when you're looking at creating healthy policy?
Yeah, like I agree with Julia. I think you have to really start with your stakeholders, and who does this policy going to impact the most? Well, it's going to impact the people who have to deliver on it, and it's going to impact the people whose lives are affected by it. And so, I think it's good practice to have conversations with those folks. And I say that recognizing that can be really complicated. Like that can be really complicated. And you'll often hear a lot of different opinions, especially if your policy is for example, a municipality. You're going to hear all kinds of different points of view. But I think part of hearing different points of view is also a benefit, because it can help you point to what kinds of information you need to share as part of the policy process, and sort of pay attention to as a new change or new policy gets implemented. So, but yeah, I would really point to the people who are responsible for implementing or who are directly impacted. That's where I would start. But I'm sure Julia and Laura probably have other thoughts too.
I'm going to just echo what's already been said, but I think depending on the level of readiness and sort of depending on the type of policy change that you're looking to bring in, decision makers around the table is sort of really critical at some point, and especially like in a municipal setting, is to have decision maker buy-in from the beginning so that they can help advocate for that particular policy at the municipal level at different tables. Is just another voice to have at the table that brings that different perspective about what kind of evidence a decision maker might be looking for, opposed to the type of evidence that you might be providing to the general public to get them on board to generate sort of that decision maker support. So my long answer or short answer is it sort of depends.
Always sort of depends, right? And I think, Julia, you spoke to when you went to the decision maker, having like that evidence based of what you were already doing, right?
Yeah. So we had, like I said, we had already been doing all of this for 10 years. So it was really easy to get the buy-in from the board directors to just write it on paper. But so we had kind of the evidence that we've been doing this already and it's worked great so far. But then also some of the added strategies from the research that I'd done. So it was like, well, I did this study, and in my presentation from the ARPA conference, I had included some links of some research that I had done. But yeah, like it was, sometimes a lot of people think like employee retention, you just got to pay them more. Well, I've seen a lot of people leave jobs that pay a lot more and go into, say, the nonprofit sector that pays a quarter of the amount just because they weren't happy. So while they, a lot of people say it's all about the pay, it's not always about that, and people just want to be happy. So having that backed up evidence made it easier for people to buy in to the policy itself. So definitely helps to have experience and have that research and the studies and conversations. So
perfect. Being mindful that it is 2:00, do I have time with you three for one more question before we wrap up? Okay, it can be a rapid fire question. And if others need to get going, feel free to leave the webinar. And like I said, I will have the recording out. Okay, so in each of your perspectives, what is an example of a quick win or something that a community can do to move the needle in creating healthy policy? So a quick win. Anyone want to start first?
Sure, I can start in a rapid fire action. 2 words, build relationships.
Love that.
I feel like she stole mine. I was going to say, talk to people. Like,
I say the same thing. Ask, talk, inquire. Like, yeah, you're going to learn the most from the people that are on the ground doing it or in that area. So it's definitely.
Good job on that rapid fire. You really took
I'll say the same thing.
Okay, one last thing before we wrap up, is there any folks in the audience that do want to ask a question? Feel free to just jump on camera quick, ask your question. We can rapid fire and answer again. But if not, then I think we will wrap up here. Not to put anyone on the spot, even years after COVID, we still hate going on camera, hey? Okay, it looks like we don't have any questions, but like Julia said, I will be sharing her presentation with you along with the recording. And then Candace and Laura have also expressed their contact information and also their website, and definitely take a look at that policy readiness tool. Because who doesn't love a tool that just takes you directly to what you need to do? I love that. So we also have some thank yous in the chat box. This is such a great concept policy idea to consider in the workplace. I'm thinking about doing it in rural communities that are looking at retention. And then of course we have a ton of other people saying thank you to Laura, Candace, and Julia. Yeah, so thank you 3 again so much for coming today. It was great having you.